Candy. My name's Alicia. I'm the nurse practitioner student that's going to be examining you today. If it's okay with you today, we're going to go from your head to toe, do just a thorough examination. Before we get started, are you experiencing any pains or?
No, I feel pretty good today.
Okay.
Yeah.
All right. Any concerns before we start the exam?
No, I don't think so. Just a wellness check today.
All right. I'm going to wash my hands here. All right. The first thing we're going to do today is check your eyesight.
Okay.
And so we're going to use the Snellen chart.
Okay.
And we're going to, I'm going to have you stand 20 feet away.
Wonderful.
All right. And so if you look straight ahead at the chart, cover one eye.
Okay.
And go to the line where you cannot read it, and then go above it.
Okay. F, B, C, P, T, E, O, B, Z, F, E, D, O, F, C, L, T, B, T, E, P, O, L, F, D, Z, L, P, C, T, Z, D, B, F, E, O.
Okay, great. Now, now try your other eye.
Okay. F, B, C, P, T, E, O, B, Z, F, E, D, O, F, C, L, T, B, T, E, P, O, L, F, D, Z,
Perfect.
L, P, T, Z, T, D, B, F, E, O.
Wow, you've got great eyesight. All right, all right. If you have a seat there. Now we're going to try the Rosen Barn test, and what it is I'm going to have you hold this 14 inches away. I'm going to have you all right, what I'm going to do now is I'm going to inspect your head, look for symmetry, and then I'm going to palpate it, feel if there's any scars, bumps, bruises. Is there any pain when I'm palpating or touching your head? Okay. All right. And then what I'm going to do is feel your muscle jaw. Can you open your mouth? Okay. Any tenderness?
No.
All right. Can you grind your teeth? Okay. That's no problem there. All right, I'm going to, your temporal pulse, going to palpate that, make sure it's pulsating, okay, and then feel your lymph nodes going down to your pre-auricular, your post, then your occipital, and your tonsillars, and then your submanual mandible. All right. And then if you don't mind turning your head to one way to get your deep cervical. Okay. And the other way. All right. And then feeling behind your neck, down here for your subclavicle. And your interclavicle. Any pain or tenderness?
No.
Okay, and now if I have you smile, all right, frown and wrinkle, all right, show your teeth, purse your lips, raise your eyebrows, close your eyes, and now I'm going to check your thyroid, make sure there's symmetry to it. And what I'm going to do is I'm going to have you drink a glass of water, and I'm going to have you hold this right now. I'm going to go behind so I can feel it from behind.
Okay.
drink? All right, good, perfect. All right. Now we're going to do range of motion, and we're going to do chin to chest. We're going to hyperextend, put your head back, and then shoulder to ear on one side, and then shoulder to the ear on the other side. And then I'm going to rotate, or you need to rotate your head to the right, or left and right. And then I'm going to palpate your cricoid muscles. I'm going to do one at a time, so I don't have to do CPR. And now I'm going to auscultate. I'm going to listen to them. So I'm going to ask you to hold your breath. Okay, hold your breath. All right, now we do the other side. Hold your breath. All right, perfect. And now we're going to do range of motion with resistance. So we're going to do chin to chest, okay, back, all right, and then ear or head to ear, or shoulder, all right, and then head to shoulder that way, and then turn your face, yeah, and the other way.
Okay.
All right. Okay, now we're going to go over your eyes, and I'm going to get a flashlight here, and I'm going to shine it in your on the side of your eyes to see about the your corneal reflex. Okay. All right. Now we're going to do the convergence test. Look at my finger. It's going to come, I'm going to have it come straight towards you. I'm looking at it. Okay. And then I'm going to check your peripheral area, so you tell me when you can see it, okay?
Okay.
Okay.
Okay. Okay.
All right. All right. And then we're going to do the extraocular movement. So if you follow my finger, it's also called the 6 cardinals because you have 6 points.
Okay.
All right. And then I'm going to take the ophthalmoscope, and I'm going to go at a 15-degree angle and look at your retina and let's see. All right, I'm going to turn it to 0, and I'm going to get real close to you, okay? But I promise I won't hit you, okay? Okay. Now I'm going to do your other side. Okay. I'm going to have you turn this way. There you go. Look straight ahead. Okay. All right, now we're going to go on to your ears, but before we do, one of the tests that I am not going to do because all of your other eye tests checked out normal is the corneal reflex. And what I would normally do is take a cotton ball and touch your corneals to see, you know, the reflex. But everything else checked out normal, so we will not do that today. So we'll go on to your ears, and what I'm going to do is inspect your ears, palpate, make sure that there's no pain or anything when I'm palpating them. Okay, they look good position, symmetry, no cuts or abrasions. And so what we're going to do now is the whisper test. And I'm going to whisper something in your ear and you tell me what it is, okay? I'm going to hold your ear so you can, all right,
Apple.
okay?
Baseball.
All right, perfect. Now we're going to do the Weber test, and I've got a tuning fork, and what I'm going to do is I'm going to place this on top of your head, and tell me where you hear the feel or the sound.
Both sides.
Okay, perfect. And now we're going to do the Rhine test. And so let me get my watch out here. I'm going to set it next to you so I've got a good sight for it. Alright. Alright, I'm going to put this on your bone behind your ear. Tell me when the sound stops or the vibration.
Okay.
Okay, and now I'm going, do you hear that? Alright, and let me know when that stops.
Okay.
Alright, perfect. Air conduction should be longer than bone, and yours was twice as long, so that's great. Now we're going to try the other side. Okay. Alright, perfect. Alright, now we're going to go on to the otoscope. And when I was palpating your ears, you didn't indicate any pain or anything, and so I'm going to use this to look into your ears. Alright, I'm going to pull your ear back, or up and back. Okay, perfect. Up and back on this side. Alright. Doesn't seem to be any tenderness or anything in there.
Oh, that's good.
Alright. So next we're going to go to your nose. We're going to go to your nose, and so I'm going to look in your nose. I'm going to use a flashlight. Okay. Any pain? No? Okay. And so no tenderness when I palpate that? Okay. Alright, and are you able to occlude one of the side? Smell? Okay. Now the other side. Do you have any like decrease in sensation? Is your nose stuffy?
A little stuffy. I have a bit of cold, but
Okay.
otherwise okay.
Alright. And now I'm going to check your senses. So let me get 2 senses. And what I'm going to do is have You close your eyes and you tell me with what this sense is.
Cinnamon.
Okay. All right. And then close your eyes again. Tell me what this is.
Lime.
Okay, perfect. Okay, we're going to move on to your mouth. And what I'm going to do is inspect it first. Do you have any sores or anything going on with your mouth right now?
No.
Okay. All right. And take the flashlight. Say, look. Yeah. Perfect. Okay. And can we get his tongue depressor? Right. Open. Stick out your tongue. Say ah.
Ah.
All right. Perfect. All right. Can you show your teeth? One thing that I'm going to do that everything looks normal in there is normally take this and check your gag reflex, which I will not do at this time. Can you protrude your tongue or stick out your tongue, pull it back in, stick it out again, go to side. All right, and show your teeth. All right, and open. Looks like your gums are good. All right. And that puff your cheeks out. Okay. Tongue, okay. Tongue, yes. Press the side of your mouth or your cheeks. All right. Perfect. All right. All right. So we're going to do the upper extremities.
Okay.
And what I'm going to do first is an inspect. And then make sure that everything is there's symmetry to it. So look at your shoulders, your arms, your wrists, your hands. Okay. We're going to do active range of motion now. So with your arms, extend. We're going to do flex and extend. So flex your arms straight out in front, and then hold them up to your head. Extend your arms behind you. All right. And then hyperextend your arm behind you. Okay. And then abduction, arm outside, out to the side, and then up. And then abduction is cross your arm over the body, shoulder blade, and then for external upper arm out to the side, and forearm up and down. Okay. All right. Now let's do that to the other side. All right. Straight up, and then in front and behind. All right, hyperextend behind. Arm out to the side and up. Cross your arm over your body to the opposite side. Arm wrapped around and touch your shoulder blade. And then the upper arm out to the side again. Forearm with hand up. And then shrug. Can you shrug your shoulders? Mm-hmm. All right. So we're going to go onto your elbow. First, do your left side and then your right side. Bend straight your elbow. Bend it at a 90-degree, like carrying a pizza, and palm up, then down. Okay. Now with the right side. Bend, yep, straight up, elbow, 90 degree, like you're carrying a pizza, and palm then down. All right, and then the wrist, one, like you're carrying a pizza, wrist up, then down, hyperextend, so I'm going to push down for hyperextend, and then act as if you're carrying a pizza, and push down. All right, now let's do the other one. Okay, hand like you're carrying a pizza, flex the wrist, then down. Yep, switch, palm down, palm up, and then let me press down. All right, now your fingers. We're going to do right hand first, then left. All right, do a tight fist, thumb on the outside, extend and spread out your fingers, and then bend your fingers back as far as you can go. So, all right. And then make a fist again. And then can you bring one finger out and move it side to side for each? Yep. Okay, now we're going to do that to the other side. Tight fist, thumb on the outside, extend and spread out your fingers, palm down, okay. All right, and then make a fist again, and take one finger out and move it side to side. Okay, now we're going to do all that with resistance. We're going to start with the shoulders, right elbow, and then left. So bend your arm, and then straighten your elbow. Okay, a fist, bend your elbow with the palm up at 90 degrees. Okay, and then I'm going to put some resistance on it, and put, yep, all right. And then, let's see, turn, yeah, okay, that one's hard. All right, now the other side. All right, all right, and then resistance with your 90 degrees, yep, pull it up, there you go, perfect. Okay. All right, we're going to continue with the rest, the wrist of resistance. I'm going to have you extend your hand out, okay, and push, I'm going to push down, okay, push up, and then flip it over, okay, push up, okay, and then can you do this? Yep. Okay. All right. And your other hand, push up. Other. Okay. And then side to side. Oh, flip it over. Okay. Side to side. All right. Perfect. Now your hands. Take your right hand first. Do it fist, and with one finger, can you spread your? Okay. Yep, and then spread your fingers, and I'm going to bend with resistance, okay, all right, and then this hand, spread it out, okay, push up, okay, all right, and then can you make a fist and put one finger finger out at a time. Okay. Okay. All right. Okay, perfect. And now squeeze my, as hard as you can. Yep, good. All right, now we're gonna go on to your pulses. Gonna look at for your brachials. Okay, your radials. And then your ulna. All right, now we're going to go on to the sensation and light sensation. And so what I'm going to have you do is I'm going to have you close your eyes and see if you can differentiate between sharp and dull. Okay, I'm going to use a Q-tip. And this is dull, okay, and this is sharp. All right. Yep, with your hands down, can you tell me if this is dull or sharp?
Sharp. Sharp.
Okay.
Dull.
Okay.
Sharp. Dull. Sharp.
Okay. All right. Now open your eyes, and I'm going to have you position your hands where they're up. Okay.
Dull. Sharp. Dull.
Okay.
Sharp. Dull.
All right. Perfect. I'm going to take the tuning fork and tell me if you can feel some vibration.
Yeah.
Okay.
Yeah.
Okay. Perfect. Look at your cap refills. Should be less than 3 seconds here. And I'm going to have you close your eyes, and I'm going to have you turn your hand over, and I'm going to write something in your hand, and you let me know what I'm writing, okay?
3,
Okay.
4,
All right. Now your other one.
1, 3.
All right. And all right, now I'm gonna touch. I'm gonna have you close your eyes, and I'm gonna briefly touch part of your body, and ask you to open your eye, and then tell me where where I was touching. Okay.
Left arm.
Okay. Okay.
Right finger.
All right. Perfect. All right, and then hands out. And so your finger to your nose. Yep, touch your finger to your nose. Can you touch your other finger to your nose? All right, now can you do it with your eyes open? Okay, and then holding, or with your hands, can you touch your thumb to your finger? Okay, can you do it rapidly? All right, and what about your other hand? All right, perfect. All right, we're going to go to your coordination, or the percussion of your reflexes. And I'm going to do your triceps, and I'm going to have your arm 90 degrees hanging down. Okay. Okay, perfect. Go to your other side. your bicep now. Hold your arm here with it. Let's see. Okay. Now I'm going to do your arm here. Oh, I'm going to use the other side, sorry. Okay. All right. All right, I'm going to go around to your back now. And I'm going to look at your back, make sure the symmetry is good. Palpate it, make sure that everything is even. Checking your spine, making sure it's in line. No pain or tenderness as I'm touching?
No.
Okay. So I'm going to go ahead and when I say 99, tell me if you feel a vibration. 99, 99, 99.
Opposite. I say 99.
Oh, oh,
You
sorry.
might have to redo it.
All right, I'm gonna go to your back now
Okay.
and look at everything. Make sure it's everything is even. Feel. Go down your spine. As I'm touching, is there anything that's painful or hurting?
No.
Okay. And as I put my hands here, every time I put my hands, say 99.
99, 99, 99, 99.
Good. All right, and now I'm going to do the thoracic expansion. And so I'm going to get in here and take a deep breath. Okay, hold it. Okay. Going to mark that. And then out. Take a deep breath out, or exhale. All right. I'm going to do expansion. So I'm going to put my hands on your back here and squeeze it tight and just breathe. Take some deep breaths in and out. Okay. My hands should expand and contract as you are, which it is. Okay, now I'm going to do percussion, just all over. Kind of zigzag, make sure each side is even. Okay. And now we're going to do the diaphragmatic exertion. So I'm going to, let's see, start up here. And okay, I'm going to mark that. Now I'm going to go on the other side. Okay, going to mark that. And it should be 4 inches. Or 3 inches. All right, perfect. All right, so now I'm going to auscultate or listen to your sounds, your lung sounds. Okay. Perfect. All right, now we're going to go to your the front, and let's see. I'm going to inspect, and then inspect and palpate any tenderness around here.
No.
Okay, and I'm going to have you say 99 again.
99, 99, 99, 99.
Okay. All right, and then I'm going to come in close and squeeze, and then take some deep breaths. Okay. All right, perfect. And now I'm going to have you lift an arm. I'm going to feel for, sorry if you're ticklish in here, for your axillary lymph nodes. Okay. Okay, your other one. Okay, now I'm going to listen to your lung sounds. All right, now what we're going to do, let me listen to your trach here real quick. Okay. All right, now we're going to go to the cardiac, and I'm going to have you, first I'm going to inspect your chest, make sure everything is symmetry in there. I'm going to have you lie down. Okay. Going to palpate your apical pulse. Okay. Okay, feel. Any tenderness, pain when I press on it? Okay, I'm going to use my diaphragm to listen to you. Okay, now I'm going to use the bell, which is not pressing as hard on for this stethoscope. Okay. Now I'm going to have you sit up and lean forward, and then we'll do it on your left side. Okay. Okay, now listen with the diaphragm, or the bell. side. Okay, perfect. All right, we're going to go on to your abdomen, and for comfort, I'm going to have you lift up your legs. I'm going to put a pillow underneath. I'm going to kind of inspect, and are you comfortable? All right. And I'm going to listen to your abdomen area. You hungry?
See?
Okay. Okay. Now we're going to inspect your liver. Start up here. Okay. Mark it. All right. Now we're going to go up. Okay. Mark it. And the size of your liver. All right. So I'm going to have you hold your breath now. Okay. Okay. All right. And then the edges of your liver. All right. And then, does that hurt at all?
No.
Okay. And now we're going to do similar to the other side. All right, now we're going to do your spleen. So I'm going to have you tilt to the right side, with the knee bent, and I'm going to get to your, and let's see. All right, go right here. Okay. All right, now if you want to turn over, I'm going to do some light palpation around your abdomen. And then, is there any tenderness?
No.
Okay, I'm going to do deep. Okay. I'm going to check for your lymph nodes, as well as your femoral pulse. Okay. And then if you take a deep breath, okay, I'm going to use my right hand, push upward. All right, and then push, feel your liver. All right. Now if you lay on your right side a little bit and then support your back, fingers, now exhale, your fingers up and, okay. So, all right, now we're going to check your kidneys. So I'm going to just have them inhale, compress. All right, and now exhale. All right. Okay, now inhale again, and then exhale, and hold your breath briefly. All right, perfect. Now I'm going to do, if you want to turn over, I'm going to do sensation on your abdomen. Close your eyes. All right, now we're going to do the light, I'm going to sensation. This is dull and this is sharp. So if you close your eyes, tell me if this is dull or sharp.
Dull. Sharp. Dull. Sharp. Dull.
All right, perfect. All right, now we're going to go down to our lower extremities. And I am going to actually have take the pillow out from underneath, and we're going to do hip flexion. So if you bring your knee back to 90 degree, okay, and then let's see, straight out again. Now, can you extend out to the side? Out, okay, then back up and back. All right, can you pull up and have it go across your body? Okay, and then back and then down. All right. Now can you do that with your other one too? Back down. Okay, up again, down to the side, up and then over. Perfect. All right. Now we're going to do the knee. So if you want to all right, so if I could get you to lie down, I'm going to just palpate your hips and your upper legs, your lower legs, your feet, ankles, any tenderness, pain as I'm doing that. Okay, I'm going to feel for your pulses, your popliteal, posterior. Okay, and your pedal. Okay, and why I'm having you lay down, can you take your heel to your, and go up and down, yeah. Okay, and then can you do that to the other leg? Okay, perfect. Your capillaries. I'm going to test the vibration. Can you feel the vibration there? Okay. Now we're going to do dull and soft. All right, close your eyes and tell me if it's dull or sharp.
Dull. Sharp. 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 Sharp.
Okay. All right, so now I'm going to check your reflexes. What I'm going to have you do is I'm going to have you put this foot over this, okay? And I'm going to take the other side of the hammer, okay? And then I'm going to have you flip-flop, okay? And I'm going to have you lift your leg or your knee a little bit, yeah, okay? All right, the other one. Okay. All right, now I'm going to have you sit. Okay. All right, perfect. As before I have you get up and do some walking, I'm going to have you close your eyes. And I'm going to touch a part of your lower extremity and tell me where that I touch, okay?
Okay, left calf,
All right?
right thigh, left foot.
All right, perfect. So now what I'm going to have you do is I'm going to have you stand up and I'm going to have you lift up your gown, and I'm gonna position this, oops, so I can examine you. All right. I'm gonna have you bend over. Oh, hold on. I'm gonna have you turn this way, and then touch your toes. Okay, and then stand back up. Turn towards me and hold out your hands and let's see, can you move your wrists like that? Okay, up and down. Okay, and then if you don't mind taking your upper body and twisting it. Okay, for a hip, and then the other side. And with your feet together, if you could stand up straight. And I'm going to have you stand there for 20 seconds. Okay, are you doing okay? Stable? All right, now if you close your eyes, I'm going to have you have your eyes closed for 20 seconds. All right, now you can open your eyes. Now stand on one foot, maybe stand on one foot. All right, can you hop on that one foot? Okay, perfect. Then do the other foot, stand on the other foot. Now hop on the other foot. Okay. Can you bring your foot out and point your toes to the floor and then toes to the sky, and then turn your toes in towards the bed and then out towards the bed, and then can you turn it sideways? So your big toe is towards the sky. Turn it and then turn it to the other side. Okay. Okay, can you do that to the other foot? Side to side, down and up, and then turn it in and then out. Okay, and how about your toes? Can you scrunch your toes?
Yeah, you've gone back in time.
Oh, I have.
You said.
Okay, what I'm going to have you do is stand in front and, okay, inspect your gown, and then if you turn towards me around and touch your toes. Okay, and then are you able to bend sideways with your waist, at your waist, and then bend to the other, bend back with your waist and forwards. Okay, and then are you able to twist to one side and twist to the other? Okay, stand with your feet together and hands to the side. I'm going to have you do that for 20 seconds. Okay, and now I'm going to have you close your eyes for 20 seconds. Okay, now if you stand on one foot, now hop. Okay, stand on the other foot and hop. Any dizziness or, okay. And now, if you don't mind, I'm going to have you go to the back of the room there. And then I'm going to have you walk normally. Okay, and if you turn around and go back. Now I'm going to have you walk heel to toe. Okay. And then I'm going to have you walk on your heels back. Okay, perfect. Okay, as we come to a close to our exam, do you have any questions so far?
No.
Okay. There are two things that are really important, especially if you have, like for your husband or son, testicular self-exam. And so it's important, and I'll give you this handout so that you can take it home with you. But have them stand in front of the mirror, check for swelling on the skin, move the penis side to side, examine each testicle separately, and then they need to cup the testicle between their hands, or their thumb and their finger, roll gently, and make sure that there's no deformities. I mean, if one side is larger than the other, then that's okay. And then they need to find the epididymis, and it's a soft tube at the back of the testicle. And it normally feels like a little lump, and then that is normal. But anything other than that, they should call the office right away.
Okay.
Now for a breast exam, this can be done in the shower, standing in front of a mirror, or lying down. If they're lying, place a pillow right underneath your right shoulder and your right arm behind the head. And then you do this for each side. Take your 3 middle fingers so if you're examining your left side, you need to take your right fingers. And if you're examining your right side, then you take your left fingers. And in a firm downward movement, go into either you can go in a circular pattern and start at the outside of the breast and go in towards the nipple, or you could start at the nipple and go to the outside. But whatever way that you examine it, I would keep it consistent. Both of these exams you should do monthly, so you've got comparison. And make sure on the breast that you check underneath your armpits, your lymph nodes, to see if there's any change or swelling or enlargement in that region too. And as you do this consistently, you will know what is normal, and if anything does arise to be abnormal, please give us a call. Do you have any questions today for our exam?
I don't think so, thank you.
Okay, thank you.